An analysis of federal data conducted by the Kaiser Family Foundation shows more than 1/3 of the nation's nursing homes receive low rankings. Oklahoma is one of a handful of states which received the lowest rating. One contributing factor is the number of low-income seniors in the state, but some people attribute the poor ranking to Oklahoma's nursing home standards.
Improving the quality of care for seniors living in Oklahoma nursing homes was the intent of House Bill 1327, sponsored by Representative Richard Morissette. But the bill never made it out of committee and onto the House floor.
You know, we have politicians that talk about all the time about protecting children, those with special needs, and the elderly. They talk the talk, but when it comes to walking the walk, they talk and talk, but they never walk the walk. So as soon as they get a little bit of pressure from their so-called friends, special interest, they fold like cheap suits.
Morissette's bill would have required a nursing home staffing ratio of 1:6. Right now, the staff-to-patient ratio is 1:8.
But what's happening is, without the proper staffing ratios between patients and nurses, individuals are going to go uncared for, the neglect increases, the illnesses and the sickness gets worse, and people end up, not only are they dying, but they're dying painful, long deaths, disgusting deaths.
Bill Whited is the State Department of Human Services long-term care ombudsman. It's his job to try and improve the quality of care at Oklahoma nursing homes.
Oklahoma is well below the national average in nursing home staffing levels. If you look at Medicare.gov and the Nursing Home Compare website, you will see that Oklahoma is substantially below in those staffing levels.
The federal Medicare website ranks nursing homes across the nation and gives tools for users to find a facility that is best for themselves or their loved ones. The Kaiser Family Foundation's analysis of the Medicare rankings shows that Oklahoma's score was one of the worst in the nation. It shows 46% of nursing homes in the state ranked only 1 or 2 stars on a scale of 5 stars.
Findings of neglect, findings of abuse at times, and overall just deficiencies that equate to the level of substandard quality of care.
Whited says Morissette's bill would have made sure every nursing home had adequate supervision.
It required that a facility would have round-the-clock, 24-hour-a-day, 7-day-a-week RN coverage, which is not currently required in the state of Oklahoma.
Keith Dobbs visits nursing homes all over the state. As president of the Coalition of Advocates for Responsible Elder Care, he's an advocate for the Oklahoma Association of Healthcare Providers.
If we were trying to staff at a level that some are suggesting, there just aren't the staff available to do that. There aren't enough registered nurses to have a nurse on duty 24 hours a day at every facility in Oklahoma.
Dobbs says many nursing homes in rural Oklahoma can't find qualified help or keep their employees.
The long-term care facilities are typically one of the largest employers in those small communities, but they are having such difficulty now being in competition with the casinos, the oil and the natural gas corporations, and then the over 40 correctional institutions in Oklahoma.
Wes Bledsoe is an advocate for nursing home reform.
You have a better chance of surviving Russian roulette than you do by going to a nursing home for skilled or rehabilitative care.
He says many people going into a nursing home for a short time while receiving rehabilitative care end up worse than when they went in.
1/3 of people going into skilled nursing homes for rehab are having adverse outcomes. And that 57% of those people, of those adverse outcomes were preventable.
There's a little bit of shining light in all this. It's still alive. If somebody would have a metamorphosis or a shining light moment and say, well, why don't we resurrect Richard's bill? We can get this done in the next legislative session because it's still alive. It still can be brought up on the House floor.
However, funding for the bill would likely be another hurdle next session. Economic analysts predict another huge budget shortfall of anywhere from $300 million to $1 billion.
The one thing that was very detrimental about that bill is it had a hefty price tag to it. The estimated budget impact would have been over $70 million for the state of Oklahoma. As staffing levels increase in nursing homes, the reimbursement rates to those facilities would increase as well.
Dobbs says the Oklahoma Association of Healthcare Providers is doing its part to improve nursing home care by offering continuing education to caregivers and their employers.